I was going to talk about something, like I was thinking about, okay, what to talk about. There are so many things to talk about. We're talking about, like, let's talk about something for the summer, like sunburn or a tick bite or something like that. But I think we need to talk about this pediatric obesity, which is a major challenge in our healthcare system right now. So talking about the chronic disease, right, in not only in the pediatrics, but overall in adults too, this obesity is the major problem, major chronic disease now in both adults as well as the pediatrics. There are still diabetes, hypertension, they are still there, but this is a rising one, and then it is like going on the top now. So as you can see that it is a big challenge not only in the adults but also in the pediatric world. So this is I just wanted to give you a little bit of overview about the problem. So as you can see, in 2010, a study done so that more than 1/3 of the children and adolescents have overweight or obesity. So we'll talk about what is overweight and what is obesity later on. We'll talk more about that to give you a little bit more definition about that. But yeah, so that is, over the time, it has increased in number. As you can see, childhood obesity has more than doubled in children and tripled in adolescents in the last 30 years. And it is associated with all the cardiovascular and respiratory as well as the endocrinological disease like diabetes. This 1.3 billion, it is the annual hospital cost related to obesity. And its comorbidities just like hypertension, diabetes, or sleep apnea, respiratory symptoms, joint disease, all those kind of stuff. So it is a major burden because 1.3 billion is being just spent for obesity and its comorbid illness. So as I was saying, from 1980, if you look at the data, this is the prevalence rate. So prevalence means at certain point of time, if you want to talk about how much is the disease burden, not like how many people got it, that is more like an incidence, but prevalence means how many people have that disease. So in 1980, it was 5.5. And in 2020, coming to 2020, that was the last study done, it is now, 19.7%. So over the time, it has quadrupled in last, from 1980 to coming to like 40 years, it has quadrupled. So you can see that. And also, obesity also depends on like it has got different variables. It is more in different ethnic or racial group. It also, there are other social determinants also like socioeconomic status, the zip code where they are staying. It all plays role in childhood obesity. As I was saying, like, let's go a little bit more in detail here. So from 2017 to March 2020, the prevalence rate by the end of the March 2020 was 19.7%, which was quadrupled, as I said, from 1980, which was 5.5%. If you go into more detail, from 2 to 5 years, it's 12.7% all over the United States. 6 to 11 is 20.7%, and 12 to 19 is 22.2%. So you can see that it is more in the kids above 6 years of age compared to the kids, the toddlers, right? Giving the number to this 19.7%, it's 14.7 million US children from age 2 to 19 have obesity. So this is the disease burden that we're talking about. As I said, while you do the study, there are different ethnic groups, different racial groups which have more prevalence to this obesity. As you can see, the Hispanic children have more prevalence to obesity than the non-Hispanic African American children, followed by non-Hispanic white and non-Hispanic Asian children. So there can be many different determinants which we'll talk about later in the presentation, what would make them more prone to getting obesity, but this is what the data shows. Among the different sex, especially among US girls, obesity prevalence was highest among non-Hispanic black girls. among US boys, obesity prevalence was highest among the Hispanic boys. So how do we say that somebody has obesity, right? So there should be a way we calculate that. So it is based on BMI, so body mass index. You might have heard that when you go to your doctor's office. So body mass index is a very helpful tool, and it's very easy to determine the body mass index. It's basically we take the weight and height in perspective, and there's a formula where you put the weight and divide it by the square of the height in the meters, and then that's how you get the BMI, okay? Now, okay, so we got the number, right? But it has to be compared, because you just have the number, it does not mean anything. So that number, we'd compare it with different age groups, like for same age group, between the same, like let's say for the boys, from that age, let's take example, like a 12-year-old boy with this BMI, it does not mean anything. But if we compare that with other kids, other 12-year-old kids, boys in the United States, then it makes difference. It makes sense after that if you compare it. So that's why we take the body mass index and then we plot it in a chart. That's how we calculate, that's how we interpret the BMI, okay? As you can see, BMI, taking the BMI regularly in the doctor's office, because when you go to the when you take your kids to the doctor's office, the doctor will always be looking at the growth chart. I'm sure you guys remember about it, the curves that they show. And we'll also look at the BMI, body mass index growth curve, and it helps to track the growth patterns over the time and help the doctor counsel the patient and the parents about the healthy living style, okay? All right, so as I said, so you get the number of BMI, then we plot it in the chart, which is a comparison. It's CDC, Central of Disease Control, it has a chart for different age group, for different sex. So we plot it against that, and then based on that, we find out what is the percentile for that. So percentile and percentage are two different things. Percentile means it is a comparison. So when we plot that in that chart, we have these kind of numbers like percentiles. So anything below 5th is underweight. 5th to 85, that should be our goal, to have a healthy weight. And then anything between 85th to 95th percentile is overweight. Anything equal to or above 95th percentile is obesity, okay? And after that also, there are like different gradings of obesity. So this is what we do. We take the BMI, compare it in the chart, come up with a number, and then we determine if the child is overweight or in the healthy weight or obesity. Okay, so let's talk about the risk factors, right? So this is the major thing that we should be talking about. And I would also like to ask the, you guys also, what do you think causes obesity? What are the factors that are playing role in obesity? Anybody want to volunteer?
What you eat.
Exactly, yeah, very important, right? How you eat it, that is very important. What you eat is important, but how you eat, because the portion size, right? Are you just stress eating or not? That is very important thing that is just. Anybody else?
Lack of access to healthy.
Exactly, yeah, lack of access to healthy food, yes. Anybody else? Yeah. So these are like some of the risk factors, right? So let's go into more details. So marketing, this is the major problem. Just look at the TV, watch TV or watch YouTube. There is advertisement after every video and you're waiting to skip that video, but you watch that video, right? And kids, when they're watching screen time, like when they're watching their tablets, and when they look at those videos and that advertisement, so these companies make the advertisement of these unhealthy foods so interesting that these kids will watch it through. Okay, they would not even skip it. They will watch it through because it's very attractive to them. So these people know the business, They make it very interesting for the kids, kids are the easy targets for these companies, because they're the ones who will be like, when you go to the grocery store, Mom, I want that, I want this, right? So, and it might be just like a couple of bucks, so why not? Yeah, for snack we need something, so why not, right? So this is marketing of unhealthy food. Now, there has been a lot of like talk going on in the policy making level about like, but again at the end of the day it's business, and we've not been able to do that, so it is still coming in our TVs, all the advertisement about all this unhealthy food, right? Now somebody talked about the under-resourced community and food insecurity. So people, when they have food scarcity, right? Also we didn't go into that data. I didn't have that data with us, but obesity is more in lower socioeconomic group compared to the higher socioeconomic group, because it also plays role with this under-resourced community and food insecurity. If you don't have like the stores which have like fresh produce and have more like processed food, it also depends on like if in that community there are like lots of fast foods, all these like fast food restaurant, you get like burger for like $2. There's a combo, advertisement of like you get like soda and a big burger. I would not like to advertise any of them, so I'll keep it to like just the burger. I would not take the name of those, okay? You know what I mean, right? So a big burger along with a drink, and that's just $2. How can it be possible when it's like all the grocery items, their prices are going up, all the fruit, vegetables are going up, but we're getting these deals of all these processed foods, all these unhealthy snacks, and their prices are like $1 or $2. How is that possible, right? Yeah, because they're targeting the main like broader population, as well as these are unhealthy foods, right? So in this kind of like under-resourced community, there has been many studies done. They've shown that there's a positive correlation between a under-resourced community where there are lots of like these kind of fast food restaurant and stores without like fresh produce, and that has got like a direct correlation with the obesity. Same with like food insecurity also, like in low socioeconomic status, there can be times when they don't have food, when they have food, and also so there will be times when they will be under restrictive food intake, and there will be times when they will be like eating more when they have more food. And all these foods are like when they don't have enough money, then you can buy all these cheap food which are energy dense, but they are not good. They're not good food because they have like they're processed food. So by that I mean like saturated fats, a lot of like sugar and sodium, so they all retain fluid in your body. That's how that's what turn into obesity, right? So that is a very important one, the number one risk factor. The overall community access to the food and what kind of restaurant or all these amenities you have around in your community, that also plays a big role. And then comes family and home environment. So there's a reason like when you go to the doctor's office, they will ask you like, does all the family members sit together and then eat their dinner? Because this is very important, because when kids learn from their parents, if the parents are eating healthy, everyone is eating their meal together, they develop that habit of eating with the parents and they're eating healthy. Otherwise, if the child is just going to the pantry and getting food for himself or herself, we don't know what the child is eating, right? So that plays a whole different role. So family home environment plays a big role. Also, like at the end of the day, the kid looks up to the parents, right? So if the parent himself, herself is not eating healthy, how can the child eat healthy? That is a big question. I always tell this to all my patients, guardians, like when they go to the grocery store, don't buy junk foods, right? If they buy junk foods, all these kind of like chips, Cheetos, or whatever, cookies, sugary drinks, if they buy all of those things and it's in the pantry and in the counter there is apple, what is the kid gonna choose? The kid is going to the pantry and will get like the juice and all those kind of stuff, not the apple. So I always tell them like stop buying those, because if the family does not buy that plan, then the kid is not going to buy that plan, right? So that's why the family and home environment plays a big role in obesity. Then there are like these individual factors also. Genetics is a big one, yes. There has been positive correlation where if the child is obese, there might be the parent who might also be obese. So there are many different genes that has been detected which causes obesity. So there's definitely genetic thing that you don't have much control on, but this is definitely one thing that causes obesity too. Prenatal risk, as in like if the mom had gestational diabetes or was like overweight during the pregnancy, that can make the newborn baby overweight at birth, right away at birth. And this is actually the childhood obesity continues and becomes the adult obesity, right? So that's why that prenatal risk also causes a big role. And there are many childhood diseases that can also predispose. Now, they are not typical diseases, but like some kind of like how the home environment is. Depression, anxiety, these are all the things that can also predispose to obesity. So for example, let's say eating disorder, right? We all know about the eating disorder. It is one of the burning problem in pediatric world right now, especially in the teenagers, where kids are like very conscious about their weight, and they are either restricting or like binge eating. So this is a big problem. Similar to that, also like kids also are like, there is also increase in prevalence and incidence of depression and anxiety in the kids also. It depends on the home environment, it depends on the school, if they're getting bullied at school, all different kind of like the interpersonal relationship. But at the end of the day, if the child has depression, anxiety, they can also binge eat, and like something called stress eating that can also lead to obesity. So why are we so much worried about obesity? Because, you know, like where I come from, my different culture in Asia, the parents like their child to be, you know, chunky, okay? So it also depends on different ethnic groups or different nationalities also. But again, at the end of the day, it's about like what they are eating and how much they are eating, just like how this gentleman said, right? So why are we worried about obesity? What is the thing that you can think of when somebody is obese? Do you guys have any idea? Okay, somebody is pointing at the heart, so heart disease is a big one. Anything else that you can think of? Joints, there you go, yeah. Anyone else? Diabetes, there you go, big one, right? So let me give you a fun fact about diabetes. So, you know, like in the past, type 2 diabetes used to be like for people in middle age, like 40s, 50s, right? After that, you would start having diabetes. But you can believe, like I've been seeing so many kids in their 20s with type 2 diabetes. It's outrageous, right? Now, when you look at the data, so the annual incidence of diabetes is increasing by 4.8% annually in pediatrics only of the type 2 diabetes. So that is alarming, you know. Okay, so these are the things that we are worried. High blood pressure. Now, how often do we hear that the child has hypertension? It is very common in adult world, but in pediatric world, it's not that common, right? Unless you have like some kidney disease or something. But now we're seeing that a lot. Now with the rise in obesity, we're seeing lots of kids with like elevated blood pressure. When we take their blood pressure, it's like elevated. So again, there can be like anxiety, white coat hypertension, something like that. In that case, the doctor will always take a look at the blood pressure and will ask the parents to like, okay, so you can go home. If you guys have a blood pressure cuff, most of the people have that, take blood pressure at home, like for next 3 days, and let me know like what the blood pressure readings are, and they call you for follow-up. Okay, so we're seeing a lot of kids with elevated blood pressure, and it ultimately circulates to the heart, right? So that will affect the heart. High cholesterol, that's another thing. So high cholesterol is associated with heart disease, and it has got positive, correlation with the obesity. As we talked about type 2 diabetes, it is also increasing breathing problems such as asthma, sleep apnea. We need to talk about sleep apnea because this is one thing that a lot of people don't talk about, okay? Now, kids, they might look very cute when they're snoring, right? They might look cute, but that is dangerous. That symptom is telling the parent that, okay, we might have a sleep apnea problem here. And what is it associated with? Overweight. It can be associated with not all the problems are due to obesity. Not all sleep apnea is because of the obesity. It might be like the tonsillar problem, adenoids problem, that's a whole different thing. But because of this rise in obesity, we're also seeing a lot of kids with sleep apnea. And sleep apnea, let me tell you, is a very, very dangerous. Does anyone know what sleep apnea is?
When your throat gets that's restricted your breathing.
Exactly. Yeah. So it can be from many things, like as I said, like tonsillar. And kids with obesity also tend to have like bigger tonsils and adenoids. And also they might have a layer of fat in the back of the posterior pharynx that collapses when somebody is sleeping, and it will make you choke while you're snoring first, and they might wake up like that. So we always ask the parents, like, is the child snoring? And if the child is snoring, have you noticed that the child wakes up like that, like choking, right? Because that means that the child is not getting enough oxygen, okay? And what happens if the child is not getting enough oxygen? It is affecting their brain. So they're not going to perform good at school. A lot of times ADHD, attention deficit hyperactivity disorder, it's commonly misdiagnosed because the kid is not getting actually quality sleep. If the child is not getting quality sleep, they cannot concentrate at school. And they're like very fidgety. They're like jumping around, cannot concentrate, forgets the things because they are very tired. Now ADHD is also the same. ADHD also has the same symptoms. So a lot of times ADHD gets misdiagnosed, but the problem comes to the sleep problems, right? And sleep apnea is one of that, okay? One of that sleep problem. So this is also associated with obesity. Joint problem, as you were saying, right? Osteoarthritis, it's more for like the adults, but in obese kids, they tend to have something called SCFE, okay? Let's see if I can remember what that means. So it's a slipped capital femoral epiphysitis. So what happens is in the hip, one of the bone gets dislocated from the other bone, okay? And it's because of the overweight, okay? So that is one of the most common things that happens with obesity in pediatric world, and we see that quite a lot. If we go to the pediatric orthopedic clinic, that's when I realized, like, okay, we have so many cases, you know. And gallstones, gallbladder disease, those are also associated with obesity. So you can see, like, as a kid, you are dealing with all these problems which we thought was just for the adults. Now we're dealing with the same problems in the kids also, right? And not only the medical condition, but they also go through different psychological problems. Look at this. Psychological problems such as anxiety and depression, right? Because these kids go through bullying at school. People call them their names, and they themselves want to look better or want to look healthy, but they don't like how they appear. And it is a constant struggle in a kid. When we said kid, this is a child who's not mature enough to understand all these things, but they're struggling within because of their appearance, and then how people are, like, calling them by different names, because school can be like really difficult sometimes, right, with all the bullying and everything, and it causes like low self-esteem, And this ultimately affects the quality of life. The child might not be able to perform at school in terms of their academic, as well as with like interpersonal relationship. Stigmatizing is also a big one, like how they are being called by different names, and they feel judged, they feel like that. So that is a big problem. And at the end of the day, childhood obesity turns into an adult obesity, and it will just increase the load in the adult obesity, right? So this is the reason we are so concerned about obesity. Do you guys have any questions until now? So, okay, now we have a problem, right? So we have a problem about obesity. Now what do we do about it? It is so difficult, let me tell you. When I have to see the kids, it is one of the most challenging things that a pediatrician has to see, because it is not something that I just give a medicine and it fixes the problem. It's not like a acute tonsillitis, I give antibiotic and it solves the problem. It is not. It has got its own comorbidities, just like how we were talking about different disease, different systems like respiratory system, cardiovascular, the diabetes, sleep apnea, so many things. And on top of that, there's a psychological burden too. So it's not easy to, and also the motivation is another thing, right? These kids are like so down and feel stigmatized that it takes some effort to motivate them. So this is a big challenge, right? But at the end of the day, that is the reason you need to follow up. We always tell the parents, you need to follow up, you need to have a yearly physical, regardless of whether you need like immunization or not, your shots, it does not matter. Even though you don't need shots, you should still follow up with your primary doctor to go through all these problems, right? To check the weight, height, any mental health issues, dental problems. In the physical, we go through each and everything. That's how we catch most of the things here. Nobody comes with like, until and unless it becomes like a big problem, then they come. But a lot of times it goes unnoticed. Like who will, if they don't have the complication, they might be overweight or they might be obese, but nobody comes for that problem. So how do we diagnose them? How do we find that out? Through these physicals. So that's why yearly physicals in the kids are is very important. Now during that appointment, that's how we find out about BMI. We chart it just like how we talked about, diagnose them with obesity. Then, you know, it is a very sensitive topic. When I have to be very careful how to word it, right? Because I don't want to shame the child. You know what I mean? Like we have to choose our words very carefully. So there's something called motivational intervention, okay, motivational therapy. So that is what we try to do at the clinic, right? So these are some of the things that we ask, we recommend to the guardians, to the parents, as well as the kids, right? So eating healthy food. So when we talk about healthy food, I mean, it is a general broader term, but fruits and vegetables, different nuts, those are your healthy food. And more like in the meat, fish, white meat like turkey, chicken, those are good food for you, compared to like the red meat, which is your like beef and all those pork. More than that, these are like healthy meal for you, okay, healthy food for you. And drinking plenty of water. This is very important, because how often do you see the kids with like, all these, again, I don't want to advertise by talking about the name, but you all know how kids are like always carrying some kind of like different sparkling water or some electrolyte mixed water. You don't need any of that. You just need a plain drinking water, okay? And as we were talking about the family, right? Family time, eating like with the family, that is very important. All the family eating together in a dining table, and the TV should be shut, right? That is okay. So before I forget, let me tell you, the TB, right? So this might be related to this or not, but TB, it's very cheap nowadays. Like how you can get, like in the Black Friday, you can get TB for like $100, $110, right? So everyone has TB, and there's TB in the kids' room, right? That is a big no, because you cannot keep checking your kids, right? What are they doing at night? You don't know. There might be PlayStation there. They might be playing PlayStation. They might be just watching TV at night. Who knows? Especially in the small kids, you can still know. But in teenagers, you cannot like barge in and then, what were you, Katya? You cannot do that, right? So that's why it's very important. Keeping TV away from the kids' room is very important, okay? I just told that, while we were talking about like in the dinner time, family meal time, the TV should be shut, okay? And also, the kids who eat dinner, lunch by looking at the tablets, at TV, any kind of multimedia, that is also a very big risk factor of obesity. We didn't talk about that in the previous one, but when kids are watching all these multimedias, they are just munching in. They're just more focused on the screen rather than the food. So they're just like overeating. So big portion, as you were talking about, like big portions, right? That is also a big risk factor for obesity, right? So things that we recommend is like, oops, I did what I should not do. There you go. Yep. Now, making the meal times a family affair, that is very important. Also the parents ask me, like, my kids are very picky. So I always tell them, like, there's no one thing that I can tell them which will fix all the problem. But these are the things that I usually recommend them. Like, when you go to the grocery store, take your kids with you. So instead of like having them chill at home using their like cell phones or YouTube or playing in the places, instead of that, take them to the grocery store and go straight to the fresh produce first, right? Go to the fresh produce. Have them pick up the vegetables. Which one do we pick, right? So when kids do that, they have a sense of like, okay, accomplishment, right? Like, I did this. Okay, let's go and help mommy in the kitchen or daddy in the kitchen. So have them also help you like wash the things, set up the table. When kids do this, then they would also like to try those foods that they just helped prepare, right? So this is one of the suggestions that I give all the parents when they ask, like, my kid is very picky eater. Let's try that. One step at a time. Like, there's no like one thing that I can tell which will fix all the problem. But these are small steps which will help you in the long run, right? So that is another thing. Have your children help with cooking and let them choose healthy food. While talking about that, that also helps for them to understand what is healthy food, right? And physical activity, this is very important, right? If it has been shown that the kids who live in the urban society where they don't have access to the parks, like the children's playground, they have increased risk of obesity. But kids who play outside a lot in the park or in the backyard, some kind of physical activity, they have less obesity in those populations. So making sure that the kids, especially now, right? This is even important now because we have all our schools ending like in couple of days now, right? Kids are like just counting how many days still to go to school. They must be very excited. But this is a big one because all through summer, if they're just like playing Xbox or PlayStation like 6, 7, 8 hours a day and not going outside and playing, of course we're going to land into the same problem. So this is something that the parents have to reinforce. Keep encouraging the child to be more physically active. How do we do that? Help with like gardening, right? Whatever the parents are doing, can you help me with that? Or take them to the park, have them play, take them for the walk. So physical activity is very important, right? Because not everyone can afford like swimming lessons or like gym. That can be expensive too, but these are the things that does not cost much. So having children help you with like different activities at home also helps a lot. Adequate sleep. There's a there's a very positive correlation between kids who are not getting enough sleep and turning into like obesity. There's a very positive correlation to that. There can be it can be multifactorial. Okay, limiting screen time. We already talked about all these things. Having the screen time, this is a big problem that everyone knows that. Actually, everyone has this problem, right? Not only the kids, us adults also have that problem. Limiting screen time is super important. Okay, and all these kind of like, you know, taking time for self-care, stress reduction, different kind of like breathing exercises, meditation, yoga, walking, jogging, all those things. These are the things that we recommend for the obesity. Okay, at least if we do a little bit of this, this will help at least with something to fight back against the obesity. Now, when you go to your doctor's office, we also, not only these things, but we also do some labs. So depending on your age, we don't do it on the small kids from 2 to 9 years. We just monitor their height, weight, and all those things. We do like all these recommendations. But once the kids are like 10 years and up, we also check them for like different problems, like let's say diabetes, right? We check them for diabetes, we check them for liver functions, and their cholesterols, so very important. These are the screening that we do. So depending on their BMI, so let's say this 85 to 94, that was overweight without risk factor, sorry. So 85 to 94 without, that is overweight. You can see that for overweight, also we do like screening, right? With risk factor also we do the same screening. So when kids are overweight, we start doing screening them for like these different lipid problems, like the cholesterol problems, their liver function, and their diabetes. And the kids above who are obese, that means they're above 95th percentile, definitely we need to check it, and we screen it like every 2 years, depending on how they're doing. If they're losing weight, we don't need to rescreen them, okay? But if they're like they continue to gain weight, or they have like some problems during this test, then we rescreen them based on like how bad it is, okay? So as I said, the obesity is associated with high cholesterol, high triglycerides. What does that do? That goes and affects the heart, and that is one of the main risk factors for myocardial infarction or heart attack, right? So that is one thing. Our high blood pressure, all those things lead to cardiovascular disease. So that's why we check for that. Glucose to check for diabetes, and then the liver function. Okay, liver function is also very important because have you guys heard about fatty liver, right? So all these when kids have obesity with all these excess fats, like all these cholesterols, they go and get deposited in the liver, and it forms a fatty layer on the liver, which affects their function. And liver is one of the most important organ of your body. Okay, it helps with like many different functions, and if it is affected, it will increase the liver enzymes. So that's what we're checking here. ALT, AST means the liver functions. So these are the tests that we do. Now, if somebody has obesity, we also recommend them. Now, we in Ashtabula are in a resource limited setting, but in tertiary care, in tertiary centers like in Cleveland, let's say in Cleveland Clinic, University Hospital, these big tertiary centers, they have something called, they have obesity clinics. And these obesity clinics is an integrated service where they have one of the pediatrician or sleep medicine doctor or endocrinologist, one of them, working along with the dietitian, physical therapist, and therapist also. Okay, so this is a group. It's like a 2-hour appointment where the patient will be seated in the same room, but different providers will see them. So this is an integrated service to help them with their obesity. These are like, so when you guys come, when the patients come to us, we also recommend them to go and see these people in these tertiary centers so that they can get whatever help that they need. Okay. All right, so that's my reference to all the data that I have today. All right, I can take questions from you guys.
Much does your genetics indicate you're going to gain weight?
Mm-hmm.
Things like that.
Yeah.
Is that pretty prominent, or is it?
Yes, it is very prominent. The studies say that 60 to 80%, 40 to 60% of obesity is due to genetics. So it plays a big role. So that's why when we look at the obese patient, we also see like if one of the parents have obesity or not. Because I've seen a lot of like correlation actually. I've seen a lot of like obese patients and their parents are also obese. So yes, genetics does play a big role in that one. But not only that, but as I said, there are so many other factors also plays role in that one. I think at the end of the day, nothing is like, it does not become, nothing comes like right away. It takes time to build up. It takes time to build up. First, when the family sense a problem, you've already started your road to recovery. You know what I mean? That's very important. When the acceptance is a big problem, because sometimes the problem is like they don't accept that. Like, okay, we have a problem. When that is a big hurdle that you have to pass first before you start changing your lifestyle modification. So if the family, if the parent, the child, the family understands that there's a problem, then it becomes easier for the physician or the dietitian, to work with the family. And yeah, it should be over the time. It can be like day and night, things cannot change like that. But over the time, one step at a time I think is the right approach. But at the end of the day, if the family does not buy the plan, then it's difficult, because I can tell the patient like, hey, eat this, eat that, this is healthy food. I can give them a list of, I can go to like the website and print them like 20, 30 different kind of healthy food and give it to them. It's a piece of paper, right? But they go home and one of the parent is like eating burger or whatever, like some kind of like let's say sugary drinks or something like that, then the child won't be able to do that. The family needs to change. The whole family needs to adopt that. So that's why in these programs that I was talking about, like in tertiary care centers, they have like these big integrated care where they have like different, they have doctors, dietitian, physical therapists, counselors, all working together. They do like motivational behavioral modification, and there are like family intervention too. So where the whole family participate in that, and then it's like a counseling for the whole family. So there are things like that, because these things are very difficult to treat, because we can always give them a plan, but it does not work out like that. It takes effort from the family itself to go further.